happens. Hi, this is Dr. Selena. Welcome to CVAMS, the Island Pulse, Cape Verdean Health Dialogue podcast. This is episode 9. We are excited to present a series that embodies the principles of integrative healthcare, with a focus this year on the impact of stress and the exploration of strategies to manage and calm the nervous system. Today, I am really excited to say that uh, who are you? Regina Montero, who is a critical care nurse practitioner. And Regina will be sharing her insights on provider fatigue in managing critical illness. Right? Was that right, Regina?
Yes,
And so we welcome you, Regina, for
thank you.
sharing your gifts with us today. And thank you for coming. And you're my first podcast, even though you're the ninth episode, however. We're just doing this in rotation. But so let me just hear a little bit about you. What brought you into this field? But first, a little bit about you, where you're from, kinds of things that you may have done in your life that even walked you towards this area. This is a very critical area, very, very important area of care. So give us a little bit about you.
My name is Regina Montero, and I live in Cranston, Rhode Island. I've been a nurse practitioner for about 7 years, but I've been a nurse for time flies, 22 years. Um, just a little background. I'm a first generation Cape Verdean born here in the US. My mom is also a nurse, and she came to the US when she was 14. And from when I was a child, my mom was always in the healthcare field and always going to work. And so I got to see hands-on and first vision of what it was like to be in this field. And I decided that I wanted to go to nursing school. And ironically, when I decided to go, she told me, nursing's really hard. It's not easy. Are you sure that you want to do this? And the running joke in the family is, this is the one time that I told Regina not to do something and I was wrong and she was right. Because I went into it and I just loved it, but it was all because I also saw the perseverance that my mother went through because coming to the US at 14, of course, at that time there was no ESL in school, and so she had to learn English and came later in life. And so when she said she wanted to be a nurse, everyone dissuaded her and told her that nursing was hard, it wasn't easy, that she had an accent and that they didn't think she would succeed. And she said that just challenged her more to go on. And even in nursing school, she had challenges with nursing instructors who, didn't like her or didn't think that she would be able to succeed because of her accent. But she persevered, went through nursing school, never repeated a course, passed her board.
You're frozen.
And so if she could do all of that, then I figured I could do it too, being that I was born here and English was a first language for me.
So you didn't say where your mom came from.
So my family, is from Cape Verde. My mother was born in São Vicente, and so that's where she immigrated from, and she was one of six children.
Wow. So are there any other nurses in your family?
There is, ironically, my mother's first cousin. She has two first cousins, that are also nurses. Their mothers are sisters. So I think it's, we always like to say it's something that's within, the bloodline. And there's also, her other cousin is a doctor. So, medicine runs through, um, our bloodline, I think.
It sounds like it's genetically predisposed.
Exactly, exactly.
Exactly. So, what brought you you saw all this and you experienced your mom's story as probably a young girl because you knew it then as well. But what made you, this is a very critical area of healthcare. This is a very sad and compassionate area of healthcare. what about you that brought you into this particular area of nursing and then becoming a nurse practitioner in this area?
Ironically, when I started working at the hospital while I was in nursing school, I worked on an inpatient hematology oncology unit. Um, as a nursing assistant while going through nursing school. And I really liked it because I saw that we did have an impact in not only the patients' lives, but their families' lives as well. And there were some good outcomes, but there were a lot that weren't also well. And I would get emotional and I'd always cry. And I always used to say, well, if I can't empathize with my patients or their families, what they're going through, then that's when I say this isn't what I should be doing. So I worked, once I graduated nursing school, I wound up staying on the unit and I worked there for about 5 years. And a part of me knew that I wanted to grow as a nurse, but I figured being that I'd worked on that type of unit, that to go to just a regular medical surgical unit wasn't going to be my pathway, and that I wanted to go to the ICU. So eventually I applied and I had to like give up a day position to go to the night shift, but
Mhm.
ICU is what I wanted to do, and I felt that was the next step in my nursing career. So then I left after working 5 years as a nurse on the oncology unit. I transferred to the medical ICU,
Mhm.
which was equally busy because now you're getting people at their worst. You know, some patients because they've been chronically ill, some patients because something acute happened. And just like in oncology, some you were able to pull people through, but
Mhm.
some you can't. And the families lean on us for guidance and how to be in these moments. And even though there was some cases, you know, that really touch you and you get really emotional, especially if they don't go well, it's the long lasting impact that you have on the families. And so it was only natural when I decided I wanted to be a nurse practitioner that I went into critical care.
Oh,
And I think it's not just for anyone, just like nursing, there are so many different pathways. Like pediatric nursing was not my thing. Everyone is meant, I think, to do something different. And for me, I felt like that was my pathway. And I also did some hospice nursing
mhm.
too, also.
Was this during your studying or hospice nursing?
Hospice nursing I did when I worked on the oncology unit. I also worked part-time for a hospice agency. So I did hospice, and of course hospice is just getting people prepared and helping them transition because our goals have transitioned. We're not trying to cure you anymore. We just want you to be
Yeah,
comfortable.
comfortable. Yeah.
And there's a role in that too when we transition our goals from curative to comfort.
Yes, yes. Very, very, very difficult work that you're doing. And I certainly understand that we all are cut out for something. And I really believe that that something came inside of us a long time before we even knew we were cut out for it. I mean, I'm a trauma specialist and now I know why.
Hmm.
It's my passion. And so I understand what you're saying. And so thank God that we do have those insights to follow whatever it is that leads us into these areas that are very difficult and challenging. So where do you find the benefits in this for you? I know you're saying for the patient and for the family. And where do you find some of the challenges?
There's a lot of challenges. The benefits is that I always feel like I did the best that I could do. And whether it was the outcome that we wanted or maybe the one that we didn't, that I was empathetic and kind in helping the family and or the patients um, along the way, because a lot of times we make impacts on people's lives and we don't even realize it, just in even if it was a 5 minute interaction or even a 3 day interaction. And so patients and families remember these. And so always just trying to be kind and empathetic while they're dealing with some of the worst moments of their lives.
Absolutely. And that's a really difficult place to be when you have to make those decisions and not only face the patient who you know may make it, or
Mhm.
like I said, in a lot of cases don't make it. And then you have to go to the family, and that's also very stressful, is, how do you approach that family? How do they hear you? And because there's all kinds of different responses that you probably receive. And I mean, does it get difficult sometimes with the family where it's hard that they have to hear that maybe they have to make a decision about their loved one, or I mean, it must get to that critical place for you many times where there has to be a decision made instantly, or I mean, tell us a little bit about that.
It is a lot of times when we're emotional, we hear what we want to hear and we don't want to hear what's actually being said. And that's just right. That's part of being human. And so it's hard because some families, you can have a conversation about how things are not going well, and some will understand it. And others, you'll think they understand it because they're nodding yes. And then after, they'll start talking about things and you're like, you are not picking up what I'm putting down, even though you're telling me you are. And it's also because they're hearing it in a very stressful moment. And there are families who just aren't ready to let go. And it's, I always tell them I understand because we always want our loved ones with us.
Yeah.
Um, but at moments that's not possible anymore. And so it's really hard. And so I always try to step back and always speak with an empathetic tone. I think how you address the situation and how your voice and your body mannerisms, they're all really important, and how you address the family. So I try to be little things like eye level and not looking down at them. So
Mm.
sometimes that means that I'm sitting down next to them, and sometimes it's like reaching out and touching their arm or saying like, I hear you. And there are moments that, I've not been in. Like, I'm lucky I still have my parents, so I can't say that I know what it's like. I can't imagine what it's like, but I can't be there. I can't imagine it, but I've never lived it. And so I try to be empathetic in those ways. Also, I experienced a significant loss of a loved one a few years ago, and that kind of changed things for me because it was different being on the opposite side of the bed receiving the news. And so I just approach every family when I'm delivering bad news the way that I would want to be approached if it was my loved one. And one of the things is honesty. If we're not honest with patients and their families about what's really going on, then they can't make the right decisions, or then they're blown away when you come with something really heavy and like, I didn't realize that things were this bad. And it's not easy. It's not easy having to sit and give bad news.
But it must have been really not easy during COVID.
COVID was hard. COVID, I think, COVID, as we know, changed a lot, and it also changed me. COVID was really, really hard because at times I almost felt defeated because yes, you go to work and you work hard, and there are times where you may not be able to save someone, but then you have the positive outcomes that help you balance those outcomes that aren't so favorable. But when you're going to work and you are busting your butt and you're just seeing people dying left and right, no matter what you do, that just takes a toll on you.
It does. And you're frozen right now, but I can still hear you, so we'll continue. Can you hear me?
I can.
Okay, good. You're back. Um, so, but COVID, the pa families couldn't see their loved ones. And I'm sure that there must have been a lot of times when you're trying to console a family and letting them know that, especially if they weren't, knowing that this was going to be the end, because maybe there wasn't anything but COVID. I don't know if
It was
COVID, huh?
it was really it was really hard because the family's view, when families weren't allowed in, it was hard because they left their loved one at the hospital. And
Yeah.
so they just had this view of their loved one where I left him in the ER. They were talking to me, they were doing this. And then as their loved one worsened, when they're able to be at the hospital, there is a significant importance to family members being present to be able to see how their loved one isn't doing well. But all they had was our word to tell them that their loved one wasn't doing well. And it was really hard to give updates. When it was a positive update, it was great. But then the next day, if it was a negative update, it was hard because you're on the phone with them and you're giving them this news. And some were in denial because they're not seeing it and they're in denial. Others just sobbing on the phone. Um, I hated when I had to call families for updates, especially when they were bad, because the emotions, it was emotional. And then I'd have to hang up with one family, and then now you're calling the next patient's
Oh
family.
my gosh.
And so it was really hard. And then we only let families come when it was end of life. And so, one patient's family member, I said, I think you all need to come in. And the family member said, well, we can't come in because it's COVID. And then they paused. And when they realized why I was saying they needed to come in, like I could just hear them, the person next to them, like the family members on the floor sobbing. Someone's picking up the phone, like, what's happening? Like, what did you say? Because they can't tell me what the problem is. And it was that was a recurrent theme over and
I,
over
I
and over again.
how, that was probably probably the most stressful time for you, for the families. How did you hold yourself together? What did you do? Plus, you were going into work during COVID and you have a family.
Exactly. And the
What was
fear,
that
like the
like?
fear of, like, I would come home from work and strip and put all of my clothes in a trash bag and wash my clothes separately and go right to the shower. They knew, like, don't talk to me because I need to go and shower. And I would just sit in the shower and decompress and be like, wow, I have to go back and do this again. Um,
Yeah.
Tomorrow. It was hard. And then, right, we really had nothing. Um, and so I'd come home and like I'm drinking wine in the shower. And then there was a period of time that I had to call like myself to attention because I'm like, you don't drink this much normally, right? But I'm coming home every day from work and that was like my custom. I'd pour my glass and I would go and I would just sit in the shower and
Wow.
my family knew not to bother me, like nobody knocked on the door. And it was hard. And then I was like, well, you need to come up with other coping skills because, sitting in the shower, you need to shower, but drinking the amount of wine that you're drinking is, also a problem when you don't drink this much normally. But so I had to come up with other coping mechanisms. But it was a while before like I didn't even realize, like you don't realize you just go through it, how much initially I was like just drinking wine when I came home.
You don't realize it, and you're trying to calm down your nervous system. You're trying to pretend that you're Regina Montero, the nurse practitioner in critical care, and this is what you do and this is what you love, but you forget that you're Regina Montero, the human being.
I know.
And those things happen. And yeah. So what did you do to kind of take care of that pain, that stress, that sorrow, that sadness that you face every day? What do you do now?
So at that point, I got into gardening because there was nothing to do. So like I started, gardening and, going out for walks because that's all we could do to try to decompress. Now, what do I do to like manage my stress? I work out, I meditate, I journal. Those are all things. And at that point during COVID, I didn't really meditate and journal like I do now. I wish that I, had those tools at that time, but I do now. And sometimes just sitting still and quietness and just processing is really important.
So, how did you get to the point where you could clear your mind to maybe not so much journal, but to meditate, because lots of people, when they're stressed, this it's just a revolving engine that keeps running and running and running, and you're trying to figure out how do I get through this? How do I fix this? How do I get out of this? And your nervous system is just zooming up. So how do you, in meditation gets it to the parasympathetic and gets you to help you calm that down. How did you get there? How did you get to that parasympathetic? How did you get to calm down?
It took a while. It took a while. And even now, sometimes I find my thoughts running away, but then I always try to center back on where I'm at in breathing, which I learned along the way as I did more researching, like just breathing and like, breathing in for four, holding for four, releasing for four. That was something that also helped um calm me. And even now, like I've been meditating for a while, there are times where I find myself, going off, but I come back.
That's beautiful that you're taking care. So what would be, well, I'm not going to go there just yet because um, I'm just curious about, because there's something else about what we do and how it does feel good that we do it. And I think that's a place where we can get grounded.
hmm
How do you think your culture played into this?
I think it played significantly because my grandmother was a very prayerful woman. She was very spiritual. It's funny because I always say she walked the line of religion and spirituality, and she managed to meld them into um, one. And so now as an adult, I take those things, from her and I just use them. And I think she was the force at that time, you don't realize that you're picking up from people and recognizing until you need to put it. But if I needed to go back, it was probably my grandmother who played a role because of how, you know, she prayed over us, she prayed for us all the time. And so um, that was it, and how she was just a great woman, and so I think a lot of that pushed on over to us.
There's something about our Cape Verdean grandmothers, right?
Exactly.
My grandmother had every saint. I used to stay with her a lot because she babied me.
hmm
They call me Bubuda. Bubuda, bendigo. She never
hmm
spoke English. And she used to baby me. And she had every saint in her bedroom all lined up. So every night we had to say, pray to each and every saint. And then she told me about a story about no Lord. I'm like,
Yes, exactly. They all
I'm
did.
like, Grandma, how did this go together?
It's funny because she had like the Virgin Mary, like a statue in her room, and she said that she would pray to her whenever there was something going on. And my great grandmother too, her mother also was spiritual. Like my grandmother's name is Barbara, and for Cape Verdean women, like Barbara's not really, a Cape Verdean
Name.
name that you hear every day. And so her name came from the fact when her mother was pregnant with her, my great grandmother hated thunderstorms, and they had a really bad storm. And that they weren't used to in Cape Verde. It was really bad, and she was nervous, and she was pregnant with my grandmother, and she would just pray to the saints, and she prayed to, Santa Barbara, and she promised her, she said if the weather got better and there wasn't a lot of damage, that her firstborn child, she was like, if this child is a female, I will name her Barbara. And if it's a male, any females that come after my firstborn daughter, I will name Barbara. And my grandmother came out as a female, and so that's how she became Barbara. And so looking back, it's probably come along in my ancestral line.
And I think that, culturally, that's meditation, right?
hmm
Some people call it even abiding. And
hmm
it's also storytelling, which is really strong in our culture.
Yes.
Storytelling is very powerful in our culture. And I think what my grandmother was doing with me was helping me calm. Help
Yes.
me calm down by stop now. You've had days over, and let's calm. And in turn, telling me the stories about, just storytelling was also a calming because I enjoyed listening. And I'm sure that we do that in our practices today, even with our patients. I
Yes,
love storytelling. And the culture is strong within us and it's very compassionate. Um,
it
so,
is.
what is if you had a self-care plan to share with others who are in your field or outside your field, what would be what would be one or two things that you would make sure was in that self-care plan?
I think self-care is big, and I wish I knew that back when I first went into nursing, because at the end of the day, we can't pour from an empty cup, right? We can't pour, we shouldn't be pouring from a half full cup, right? I'm pouring from a cup that's overflowing into you, because then what happens if your cup is drained? And so for me, the big things for self-care are I like my alone time. And sometimes that is I go in the bathtub and I tell them I'm going to take a bath unless the house is on fire. Don't knock on the door. Is there anything that you need me for right now? Because I'm going in the bathroom and I'm getting in the tub and I'm not talking to you until I'm done. And so I set those boundaries and they know. And sometimes I'll hear my kid, like one will come home, Mom, and the other one will be like, oh no, she's in the tub. And he's like, oh, okay. And so, but they know that's my time. Meditation, I have like a little space, here at my house that I come in and I'll let them know I'm going into the meditation room if I'm think because the last thing I want to be doing is meditating and then they're knocking on the door because that pulls me out of it. Um, and so for me, like those are self-care rituals that I do, taking my baths, meditating, um, exercising, right? That's also something like I try to work out at least 3 times a week. The weather's getting nicer, just going for walks. It's little, it's little things that we do that go a long way because if we don't refill ourselves and we're burned out, then I'm useless.
Useless, absolutely. We have to take time out. I'm very much um I'm happy Selena, but there's the time, but so the other part of Selena really enjoys being with Selena,
Yes.
quiet. So I really understand that. But I saw you do that when you came on today. Immediately set boundaries, like texting your kids and letting them know, do not disturb me. I'm in a podcast.
Yes. Yes. And
And
I have to, and they're older, they're not little kids, but you think that because they're 21 and 17, they're not qualified, but they still come looking for, mom and whatever. And so I do, I try to set my boundaries. That's really important and something that I've learned, later in life.
But I think, the fact that you have a care plan, you activate it. I hope it's consistent
Hmm.
that not only when you need it, but even when you don't need it, because that's important that your body and your mind gets to understand that this is what has to happen on these all the time,
Hmm.
not just in the times when there's an amygdala attack. So it's good that you're doing that. And I think that the journaling is amazing. We're going to have Lucy Coutinho, who's going to talk about her book that she wrote on journaling. So
Hmm.
you'll be hearing from her. Um, and my last question to you is, what is your future vision?
Um, You know, I think my purpose is to help people, and so I'm trying to figure out what that looks like in the next, 5 um to 10 years. I've developed an interest in um women's health and especially women's health of, women of color because we also know, and women in general, because we know that a lot of studies were done on males, right? And especially, when we're going through perimenopause, it's a lot of things that people didn't talk about before. So I've kind of gained um, an interest on that and what we can do to help people. I'm also certified in Reiki, and so trying to figure out how I can incorporate that and maybe, eventually take my talents moving away from the hospital, but doing other things. And so that's something that I've been meditating, beginning to meditate and journal on. And what does that look like for me. And, I just came back from this mission trip with the CVAMS, which was um,
We were there
really beautiful.
together.
Yes, we were there together, and it was um, great. And it was just amazing to be able to go back and also in the native language because I'm fluent in Creole to be able to go back and give back because there's a lot of things we take for granted here. And continuing to do that, mission work to be able to go back and help as best that I can. So it's just refiguring out and rebranding myself, right? And what the next chapter will look like.
And did I hear that maybe you're thinking about getting a doctorate?
Yes, I am. I'm working on my doctorate. I had started and then I paused, and I am going back starting this fall to complete my doctoral work to get my DNP. And I've been looking at provider fatigue and burnout. And so I'm doing some, literature review on that to see if I can come up with a project to be able to work on to obtain my doctorate. So yes, also completing my DNP, which is my terminal degree.
So I thought that was my last question, but this one really is. Um, so what would you say to we as providers to help ourselves in times of stress and burnout, feelings of burnout?
I think that we need to pause and one, recognize what we're feeling and know that it's okay to feel it and to be able to talk about it, right? And to be able to have, I say, your tribe, because not everybody understands it. Like if I have a really stressful day or something, like those that do what I do, or my mom, who's, a nurse, I will just come home and unload and she'll just listen to me. And my aunt is a social worker and I'll just unload and they just listen. And sometimes for me, that's therapeutic, but recognizing the feelings and working through it, because if we don't and we just shove it down and keep going, that's when we really stop becoming burnt out. And then when I start recognizing that I'm a little crispy, I'm like, oh, this isn't, good. I need to reel it back in because that's not who I am. Um, but it's not easy what we do. You're having joyful moments one moment, and then the next moment you're resuscitating someone, and then the next moment you're listening to a family member that wants to cuss you out over something that's absolutely absurd. And you're just like, okay. And so we're always switching into we're always wearing different masks.
Yeah.
And so we need to recognize what we're feeling and come up with a plan, what works best for you to be able to work through those emotions. Because if we're burnt out, then um we're we're useless, right? We can't
Useless.
we can't give.
Yeah, and it's also I like the idea of setting boundaries because when somebody, friends, family, whomever knows what we do, then we become that in our social world. And
Yes,
sometimes I don't mind having the conversation, but I don't want to be out there, yes, working my mental health stuff with you and neither my your medical stuff with the family because they'll call you first time, Regina, this is what I'm feeling, and it's like, oh, Selena, I'm having this now. Let's, you've got to take time for yourself. If you
exactly.
want us to reach out, and you have to set a boundary where I'm going to listen to you. I will hear you, but give me 24 hours unless this is an emergency.
Yes.
So we should set boundaries, and I think boundaries should also be part of our care plan. So thank you for mentioning that as well.
And boundaries with patients and families, because sometimes they can be
Be difficult.
a lot. And so sometimes setting boundaries, and people think they can speak to you in any way they want.
Goodness.
And, I had a patient that was and I said, well, I'm going to step out of the room. And when you decide that you're in a place and when you feel that you're able to speak to me in a respectful tone, you can let your nurse know and I'll return. Until then, I'm stepping out because I'm not listening to this. And I just kindly walked out. And after about 20 minutes, I the patient asked for me to go back in, but they were just setting boundaries in certain circumstances
Yeah.
that, it's
And
not
and
okay.
and that's a problem across all disciplines.
Yes.
All disciplines is that patients are losing respect for who we are.
Yes, and so that was a big when I went on this mission trip, when we were on this mission trip, I came back and my coworkers were like, "How was it?" I said, "First and foremost, everyone was humble and they were so thankful for everything that we did for them.
Yeah.
Whereas here, these people are cussing us like they're just speaking to us so inappropriately as if, it's terrible certain situations people are in, but they're not situations we created, right? We're here to try to help you, but people don't always see it that way. I said, and it was so different because that's not what we experienced when, we were in Cape Verde, doing this. People were just very
Absolutely.
kind and humble and thankful
So
for
thankful.
our help. And so here, it's like, I don't know, and it's not that you need to, bow down to us, but there needs to be some,
Some
like
level of respect.
some level of respect, which
And
has
and
been
just
lost.
identifying that I did, I've been doing this for a period of time and I did get educated in this area and I think I can help you.
I know. And it's hard because we have so much on the internet too, right?
So
And then
much.
you have patients and families that are like Googling and, well, it said this and that. Well,
Yes,
okay. But I did go to school for many years to get to where I am to be able to give, myself and my colleagues our opinion. So it's really hard when it's hard now. It's hard to deal with the public.
difficult. My daughter's a PCP and they're coming in telling her what kind of medicine they need now. This is what
Yes.
the audit.
Yes.
It's hard and it's sad because we can't lose doctors,
Exactly.
and shouldn't have to go and end your night in distress. So thank you. Oh, I just want to say one last thing. Dr. Veronica Pimento?
Yes.
She's the GYN. She does a lot of women, the stuff you're talking about on women.
Hmm.
You should talk to her.
Yes, I
Yes.
had reached out to her briefly because I saw something and I've just been doing my research because yeah, it's a strong interest. I think, we
She,
women go through a lot and a lot of times, we may be labeled as crazy. It takes a lot sometimes for someone to realize what's really going on with us because our symptoms get poo-pooed. And also, especially when it comes to like perimenopause, people are having all these symptoms and at the end of the day, it's like, well, yeah, these symptoms are real and, they can happen for a long time before people go into full-blown menopause.
yes, and I think that with perimenopausal menopause, that fit couples need to understand the transitions in that as well because it does change the relationship many times.
Yes, it does. It does.
So, she will be our second episode. Right now,
Okay.
we're just gathering all the episodes and then we're going to organize them and shoot them out. So you're number 9 and she's number 2. So don't miss her when
Okay.
she's doing with Dr. Barrows, Maritza Barrows, who's at Tufts. So
Perfect.
thank you for joining us. It was so
Thank
good to hear from
you.
you and all your insight and your gifts and sharing them with us and great information on stress reduction and making sure that you do this on a regular basis. It's not just like, oh my God, I'm stressed today. Let me go for a walk. No, it's doing it consistently. It doesn't have to be
Yes.
for long periods of time. It could just
No.
be, 5 minutes in the morning, doing some diaphragmatic breathing, the box breathing, and
Hmm.
just letting your body start off with in a good flow rather than starting off in panic. You start in panic, you
Exactly.
end in panic. So this is Dr. Selena saying thank you for joining us. I hope you found this conversation to be helpful and thoughtful and intriguing and will help you make your self-care plan and know how important that is. We'll meet the next episode. Episode 10 will be in 2 weeks, following episode 9 when we stop airing. And it will be on the leaders of tomorrow. Dr. Maritza Barrows will be meeting with our young leaders of today and talking about their vision for tomorrow in various areas, not just medical. Regina, thank you so much. Thank you for being here. And I want to tell everyone, don't, also follow us on Spotify and YouTube, CVAMS. And join us. Come with us on our mission trip, right?
Yes, yes,
Yes,
you
we need
will.
all type of wonderful, wonderfuls there, and
All
you
type of wonderful people that we need. We need
have
everybody.
everybody, and we need
Everyone's
your
welcome.
donations too. We need so much.
We need so
We
much.
keep on going and we keep on flowing. So from Dr. Selena to you, ciao, obrigada. See you at my next episode. Regina, thank you, but don't leave me yet. Okay.